We still have a little bit of time for Q&A, so I've got a microphone. Do we have some questions? We've got a question from the internet right in the back there. Julie?
Yes. Grace Bowl asks, if a patient doesn't understand why you're asking them to pick a song or think it's silly, how do you explain it to them for more buy-in?
Great question. I love it. What we do is we'll show them examples of previous patients, of what they've spoken about. We have a group of expert patients who've been through the process. So we'll say, look, these are the things that other people have said. But again, I think you have to be humble. Humility is a massive part of what we do. So if you get a patient that says, that's too weird for me, I don't like it, fine. Try another fishhook. I constantly think that pain education is like developing a range of fishhooks. You've just got to dangle different ones out there. You've got to see who grabs, which person will grab the attention. For some people, the song lyric thing will definitely never be their fishhook. But for some people, it's the thing. It's the thing that grabs their attention. It releases their experience. So yeah, great question.
Great. More questions. I thought I saw a couple of hands that were about to pop up. One question that I had, and I'm glad that I don't have a hand up at the moment. So earlier you mentioned that a patient objected to being asked to provide a 1 through 10 value for the pain.
Yes.
And some years ago I had a patient that described her symptoms as like a band around her chest, and a band around somewhere around her hips, but then up here she felt kind of a whoosh, and down here she felt kind of more of a zoom.
Yeah, where do you put that on 0 to 10?
I don't know. How do you chart that?
Yeah, but a whoosh that's a metaphor, isn't it? But again, thinking about, I think numbers really are a problem, aren't they? Well, hands up if you ask people VAS scale 0 to 10. Not many. There's actually quite a few people who don't. Yeah. Now, this is the problem. What keeps coming back to me whenever I go around the world teaching, people keep saying, I know it's problematic, but at the same time I have to do it. The insurance companies say, I want to know what number it is. That's a problem, isn't it? Because that means that we're not doing maybe what's best for the patient, we're doing what's best for the insurance company or for the
I was just going to say to that, as a student, we have to.
Yeah.
Yeah, so we're still learning that curriculum, so unless we come to places like this, then we're not going to get that change, right?
I think I would argue, don't stop using VAS, because I think it has its place. But I think the main thing that hopefully I've highlighted for you is the problem of it, the problem that it can bring.
Question right next to her.
I missed the name of the author of Wolf Hall.
Hilary Mantel. Hilary Mantel, fabulous book.
Okay, and a question over here in the second row.
Joan? Yeah.
So if they use a metaphor that's very destructive, like the metaphor that I'll never forget was, my patient said it was like sandpaper rubbing over a piece of raw salmon. Okay, I'm going to write it down.
Yeah.
But when you listen to that. And
it was like sandpaper running over raw salmon.
Yeah.
Whoa. Okay, that's full on.
So you validate their experience.
Yeah.
Do you then come to a point where you invite them to try to think of a less threatening metaphor, or? Perfect.
Change the metaphor. What I'm looking at doing, particularly with song lyrics, is we're asking people, okay, what's the song now? What's the song at the end? That's the most interesting thing. We've had all sorts, Beach Boys type stuff at the end. It's like happy stuff. So you can see this shift between pessimism towards optimism, hurt towards hope through song lyrics. Why not? I've done it for years. I've been teaching people to do it, and the results can be quite interesting. But again, it's requiring more research. That's my passion in the years to come.
We have a question towards the back here. We have a microphone for you.
So going back to what they just said, do you ask them on day one, what is the song that you're feeling currently right now, and what's the song that you want to be at?
No.
Or you give it just...
Yeah.
Okay.
Can you imagine within like 5 minutes of meeting another human being saying, if your pain was a song, what would it be? Probably wouldn't work so well. You have to build up that relationship first. You've got to gain that trust. And not always. It's not appropriate. Some people will express their experience of pain quite easily. Other people will struggle, as we know. So maybe what this is just finding ways to help them. Guidance, facilitation is about guiding, not telling. Guiding, not telling.
A follow-up, and then we've got another question in the very back.
I guess just to elaborate on that a little bit more, I wasn't saying, like, when you actually tell them, you know, if you feel like the song is going to help, do you then ask them, you know what, I want you to also pick what song you'd want to be at some point, that same day?
Yeah, or towards the end when you look at the before and after almost.
Okay.
So you sort of see what that cognitive shift is, that idea of moving towards something more hopeful, more positive. Yeah. We had a lady, I went and taught in Liverpool a while ago, my hometown, and we had a physio there who, on reflection, she said she had a patient who chose a lyric, "It's hard to dance with the devil on your back, so shake it off." That was a big thing. That was her thing at the end. She wanted to get rid of this devil or to sort of try and get on with her life. So people, I think song lyrics can be interesting.
We have one question back.
Thank you for a wonderful presentation. When you ask if anybody has background in education, there were almost no hands up.
Yeah.
How do you think we can solve this problem in physiotherapy? Obviously, if we think of ourselves as educators and no background. So.
Exactly. I think, I mean, I go and do some teaching at a couple of universities, and I think one of the things that I'm always talking about is integrating andragogy. Andragogy. Who knows the word andragogy? Yeah. Adult learning, teaching adults, teaching people stuff. We need to maybe integrate some of the theories of education into undergraduate practice. When I did my MSc, which was in education, I remember sitting there feeling really frustrated, thinking, why didn't nobody tell me about this stuff at undergraduate level? Why didn't they help me make sense of the dynamic relationship between how much you challenge somebody and how much you support somebody? Or what about this? Who's ever seen a patient that's been blocked, that gets stuck? They don't seem to be able to get through something. They're blocked with their learning. They're blocked with their understanding. Guess what? Teachers know what to do with learning blocks. It's trying to develop unblocking strategies, understanding why people get blocked sometimes. So I always think, yeah, we need to integrate it into undergraduate education, I'm sure. Yeah, great point.
Thank you.
That brings us